Hello, I'm excited to see you, Jordan, and get started on our home birth consult. We're recording this so people can get to know us a little bit before coming into the office.
Yes, I'm super excited. Happy to see you. Haven't seen your face in a little while, so it's
Ye-
nice. Yeah.
Yeah, it's good to see you too. I just got back from my month-long vacation, so I'm feeling very refreshed and very zen and ready to start the new year of births and midwifery. So we got a really great list of questions from the Childbirth Connections, 6 pages of questions. We'll see how many we can get through. I actually wanted to add one here at the beginning. And the first question to think about is why choose a home birth? Why would somebody want to do this process at home? So we'll talk a little bit later about the benefits of midwifery care and really getting to know your providers and spend a lot of time with them. But specifically, the home birth is really amazing for people who are looking for a natural physiological birth. If that's the kind of birth that you want, you are more likely to achieve that birth by remaining at home than you would be in the hospital. Some other reasons I came up with were continuity of care, like we said, getting to know your midwives. You can have more control in decision making at home than you usually can in the hospital. So that's a big important factor for people who have strong preferences for how they want their birth to go. I always say that the postpartum time is one of the best times about home birth, that those first couple hours after the birth and really being undisturbed, being able to be in your home, eat your own food, have your other kids there if that's what you want. And then the next couple days, not having to leave your house, not having someone come in your room every hour or two, waking you up when you're trying to get a little rest. A lot of people say that one of their favorite parts of having a home birth is the postpartum period. And we know that it lowers the C-section rate and lowers the intervention rates. Can you think of any other good reasons, Jordan?
Yeah, just piggyback off of the postpartum conversation, people find that they heal faster postpartum because they're actually able to get sleep. They breastfeed better because they're able to really bond with baby. And yeah, it decreases things like postpartum hemorrhage, postpartum, just to be able to have that undisturbed period. So,
Yeah, keep that oxytocin flowing.
mhm.
Okay, so the first question we're coming up to is, are you licensed to practice in the state? We currently have our practice in Florida, and our main office is in Vero Beach, Florida. And yes, we are both licensed to practice in the state. Otherwise, we would be committing a crime. Um, my license is as a advanced nurse practitioner with my specialty as a midwife. Um, there are a couple different nationally recognized midwifery credentials in this country. One of them is a CNM like myself, a certified nurse midwife. Um, and one of them is a CPM, which is a certified professional midwife. And that is what you are, Jordan, right?
Yes, I'm both a certified professional midwife and a licensed midwife. They're kind of the same, but a little bit different as far as Florida state laws go.
Yeah. So we are both licensed in this state, which means we carry malpractice insurance, which means we have a regulatory body, which means people have a right to file complaints about us. They have a right to investigate us. So there is an accountability process to ensure that we are providing good quality care, as opposed to something like a birth keeper, who may have very little training and not a license and has no regulatory body making sure that they are safe.
Yes.
Okay, so how long have we been in practice? That's a good question. I have been a nurse midwife now for 21 years, long time. But this home birth practice has been around since 2010. Before that, I practiced in a birth center down in Miami for 5 years. And Jordan started working with us January of 2022. So we're recording this in 2025. So it's been over 3 years that we've been working together and loving each other.
Yeah, and I've been attending home births and out of hospital births and in hospital births actually for the past 7 years. So my
Okay.
experience between the two of us.
Yeah. So how many births have we attended and how many of these have been home births? So as a midwife, the primary midwife, I've been at about 1,060 births or so. I got to look at our latest stats, but over 1,000 births. 400 of those were in the birth center before I started my home birth practice, but this practice has seen over 600 some births. As a nurse, I worked 5 years prior to that, and I've seen thousands of births even before I became a midwife. Um, what are our core values, priorities, and goals as a home birth midwife practice? So I like the goals of being safe, sacred, and sustainable. I think those are very good goals for all midwife practices to have. Safe means obviously practicing within guidelines, practicing with evidence-based care in mind, keeping up on our education, and all of our skills. So we want to be as safe as possible in our home birth setting. Sacred, meaning we really see this as an important life event for your family. We want to keep it sacred and holy and respectful. And sustainable. And sustainable means that this practice is able to keep going, that the midwives don't get burnout, that we were able to keep going and pay our bills. That we don't fizzle out in a couple years as some practices do. We want to be sustainable for the long run. And we want to be training future midwives so that your daughters and granddaughters can have midwives as well. What would you say some of your other things you want to add, Jordan?
Yeah, I think that a lot of our core values, they match each other, considering before I became a midwife, I was actually learning as a student under Angie. So we've been able to really match what our values are as midwives. I think that, the beauty of midwifery care has a lot to do with clients, just client-centered care and the way that they're able to share decisions. Whenever they're making decisions on their prenatal care and postpartum care, that is an important part of midwifery, is just making sure that our clients know that they're involved in their birth experience. So yeah.
Yeah, and that's been shown by evidence of helping people feel more satisfied with their birth, is that they're involved in the decision making. So a lot of times you hear some buzzwords called shared decision making. Those buzzwords are thrown out. Some people actually practice them and other people don't. I like the term that's better, client-led decision making.
Yeah.
As a midwife, I feel like it's our job to give you information if we know some, to give you evidence if there is any, to tell you about pros and cons of all the different decisions that you're going to be coming up with. But it's ultimately the clients and the family's job to make those hard decisions. It is your family and your baby, and no one's going to care about that and know your values more than you are. So instead of shared decision making, it's client led. Obviously, we're here to support you and tell you what we think is safe, but that may not always be obvious. There's a lot in maternity care that hasn't been researched, unfortunately. So there are a lot of gray areas, but we're there to walk with you and to support you in your decision making. I think that obviously our home birth practice really truly believes in physiological birth. We understand physiologic birth. We've witnessed a lot of physiologic birth. We have tips of how to help it along and just be there and witness. So that's pretty amazing. And then I think the other priority for me, I am a nurse midwife. So we have different scopes of practice, a nurse midwife and a CPM or licensed midwife. Mine is kind of a broader scope. So one of my priorities is expanding access to people who would like a home birth but are having trouble accessing a skilled provider to do that. So that may include somebody who has a breech baby and who wants a vaginal breech birth at home, or maybe somebody who has some twins and wants to do a twin birth at home.
Yeah, or somebody who has a breech baby that wants to turn that baby and have a virgin baby at home.
That's right. We just did a great video of an ECV that we did. We posted it on our sites. Okay, so is our practice? Yes, our practice is a group practice. There are 2 midwives here. So you will get to do prenatal care and visits with each of us. It could be either one of us at your birth. So it is important to get to know both of us and feel comfortable with both of us. The safest way to do birth is to have 2 trained people at every birth. So most all of our births will have 1 midwife and a birth assistant. Okay, so at least 2 people at every birth. Sometimes we have a senior student that we're training, and you'll get to meet them during the prenatal visits, and they will be the birth assistant at your birth. So there'll be a midwife and a senior student. Sometimes Jordan and I coincide, and you'll be able to actually have 2 midwives at your birth. That doesn't happen all the time, but it does. And sometimes we have birth assistants from the community that help out, that are also trained doulas. So all of the birth assistants that are not senior midwife students, they've been trained in neonatal resuscitation, and they've been trained as doulas, and they've been trained as birth assistants. So at all births, we're having 1 midwife and 1 other helper person at least. Okay. Some good things for you to know about is that midwives are humans, and we do get sick days, and we do get days off. And that is the benefit of having a 2 midwife practice, is that it keeps us sustainable. Both of us midwives are going to take a month of vacation off for a year. Mine is in the summer usually like mid-June to mid-July. You know, Jordan's getting married this year, so she's taking a month off around her wedding. And so having that set time off where we can decompress and not be on call is very important for midwives not burning out and to keep being sustainable for many, many years to come.
Yes, I recommend that for all midwifery practices, and have a partner that you can share time off with.
Yes, and I had a solo practice for a long time, and a lot of things in my life suffered. My relationships, my responsibilities with my children. So I am very grateful to have a partner and to keep us sustainable. So it is your job as our client to schedule appointments with both of us. We will try to help you facilitate that, but that is your job to get to know and feel good about both of us. Okay. What would happen if for some reason neither of us were available? That is very rare. It's in the realm of possibility, but it is very rare. Maybe that happens once every 5 years. But the good thing is we have good relationships with the area midwives. So once about every 5 years, I have to call one of them and say, hey, can you attend this birth for me? But we will arrange to have a fully licensed midwife capable and ready to come to your birth. Okay, what doctors provide backup for situations beyond our scope of practice? Okay, so say you're developing some kind of high-risk complication that you need co-management with a doctor. The doctors that specialize in these high-risk situations are called MFM, maternal fetal medicine, or a perinatologist. And we have good relationships with several of these in the area. We have relationships with the ones at Cleveland Clinic, both at Indian River Hospital and the ones in Tradition. We have worked with Dr. Stossel, who used to have an office in St. Lucie, but now it's just Palm Beach, and Winnie Palmer, which is a great MFM over in Orlando. So normally if somebody needs the MFM, we're sending referrals, we're sending them your chart. You go to see them in their office, and then they send their results and notes back to us so that we're all on the same page of the management. And then usually the plan is we're continuing a home birth, but co-management of some certain issue that you're having during the pregnancy. The other doctor that we have a relationship with is Dr. Nathan Riley. And he is an OB that really supports home births and midwives all over the country. And I can call him and text him whenever I need to about certain cases. Jordan can as well. If we have an issue that we just want to get different feedback on, but he's not a local doctor. he does do telehealth if people want to consult with him in that way. Okay, Jordan, you've got some other things you want to add at this point of our papers?
Yeah, so when it comes to the process of, what to expect for the big day, at what point in my labor would you come to my home? Now, this might look a little bit different for everybody depending on what's going on with your labor, but typically we go over some extensive reasons to call the midwife towards the end of your care with us. During our prenatals, we talk about quite a lot, and education around birth and what to expect are one of them, as well as, things on how far apart should your contractions be, how long they should be for, how intense they should be, right? So usually in active labors around that time that you'd be calling us and we'd be coming to your house. Now, we don't always want to pay attention to just that 511 rule, right? Especially if we're still very excited about those contractions and everything's pretty mild. We want the nice, strong contractions that, you could benefit from support from your midwives, and then also, just have us have enough time to set up at your house before your baby comes, right? So the other parts of who would come with us and what their roles would be, as Angie was outlining earlier, we bring either one midwife and one birth assistant or both of your midwives. In some birth cases, we're going to bring even more people, especially for twins and breeches, right? So you might have 3 or more at your birth. Things that we bring with us, we kind of set up like a little mini birth center in your house. So we're bringing suitcases of quite a lot of equipment. The things I'm going to say, it's a lot because, that's just what it is. But we do our best to kind of tuck things into corners of your houses so you don't notice everything kind of intruding your space, right? So we bring things like IV fluids. We bring antibiotics, anti-nausea medications, especially if you're having a lot of vomiting. Things like herbs and homeopathy for people who decide that they want some more natural remedies instead of, medication route. We bring suture materials in case you have a tear afterwards, with lidocaine to help numb the area so you don't have to feel it. We bring resuscitation equipment for baby, oxygen. We even bring the laughing gas in case you're having a hard time coping with contractions. You need something to take the edge off. Monitoring equipment for you and baby. We do intermittent auscultation on baby with a Doppler, for fetal monitoring. And then we also bring some other things like affirmations, rebozo, TENS units. So anything that we think you might need, things like postpartum hemorrhage medications, we're going to have on hand at your birth. And then preparations to make in advance, as far as what the parents are to prep for, that's pretty basic. You're having things like towels, washcloths, trash bags from around your house, as well as a birth kit that we give to you towards the end of your care that has things to help protect your mattress, and catch any fluids that might happen. Now, depending on the way that you want your house to be set up for your birth, you might want to get extra materials, but that's kind of case by case. And then, of course, some preparations for birth. We really recommend childbirth education courses to actually help prepare you for the big day.
Okay, good job, Jordan. So it says, how long are prenatal visits and whom would I see? So we usually do 1 hour prenatal visits. We give you that whole hour. And I'm usually in the office Monday, Tuesday, and Fridays, and Jordan's days in the office are Wednesdays and Thursdays. So you can see both of us. You can flip-flop. You can see half and half. It's up to you. But we do all of the routine prenatal stuff that you would get at a typical doctor, like fundal height measurements, listening to the baby, blood pressure checks, weight and urine checks. But we do a lot more than that. So we try to do an educational topic each time That could include exercises to make you feel better in pregnancy and help you have an easier labor, nutritional diet reviews and guidance about what are the healthiest things to eat during pregnancy. Could be stages of labor, breathing in labor, breastfeeding benefits and how to do it, postpartum mood changes, all sorts of things we're going to talk about. And obviously, you're going to have things you want to discuss. So we allow you a lot of time for that. It's not a quick visit. And then we do family check-ins. How's your partner feeling? How are the kids doing? Is there any interesting social dynamics going on that we need to talk about? And we also do like to do mood quizzes or assessments and do a lot of mood support. Pregnancy and birth and postpartum is a transitional time. For a lot of people, it's amazing and beautiful. For some people, it's stressful. It's emotional. There's a lot of different emotions that are going to come up. And we've taken advanced training by Postpartum Support International to help you support you in those mood changes. So we do all of our lab work at the office. You don't have to go to Quest. You can do it right there at the office. We have a fetal monitor to do non-stress tests if those are needed. And we have a little ultrasound to check baby's position at the end of pregnancy if we need that, or to estimate a due date in the beginning of pregnancy if that's needed as well. Okay, so what might lead you to view me as high risk and how would that affect my care? So from the very beginning, when we start talking to you, we're talking to you about all your different health issues. And there are some things that might come up that we say, no, that's not a good idea for you to have a home birth with us. Okay, some things might be that you have chronic hypertension before you're even pregnant, right? So we might say that's not going to be a good home birth with us. If somebody wants to do like prenatal care with us and be co-managed by us and an OB or us and an MFM, we're open to that. And we have prenatal care only packages. But there are some conditions we're going to say, no, I'm sorry, you're not a good candidate. So that could be from the very beginning when we first have our first conversation. Other things that might come up later, say you have an anatomy scan and they find a big heart defect in a baby. That's rare, but it does happen. And those babies that might need immediate heart surgery or stabilization should be born in a hospital. So it's one reason we recommend an anatomy scan around 20 weeks. So sometimes you'll find out midway through pregnancy, and that's not that often, but it can occur. And then there's some things that might require co-management with the MFM, like we talked about. So say, for instance, there's some interesting findings on the ultrasound that they want to verify a month later, maybe a marginal placenta previa, perhaps some growth issues in the baby. So you might be seeing two of us. Yeah. So we could refer you during antepartum or in labor to those doctors like we talked about. Some things that maybe other midwives might consider too high risk for home birth, I might actually do at a home birth because I have a broader scope, like the breech births we were talking about.
Yes.
Okay. Sometimes people who even have had hospital births and have not birthed with us come to us for postpartum care, which is quite amazing, having hour-long postpartum visits. We do a lot of lactation support. So some people come for us for that or for GYN care that have not birthed with us at all. Okay, do you want to talk about companions during labor and birth?
Yeah, so let's talk about doulas. This question asks if we have any experience with doulas during labor and birth and if we encourage it. To put it in a short way, yes, we do encourage doulas. We recommend them, especially for first-time moms, especially for VBACs or people who are choosing to have a vaginal birth after cesarean at home or in the hospital, and anybody with previous birth trauma or traumatic experiences in their life that might pop up during their birth experience. Those are some big ones, but even moms that are on baby number 4 and have a lot of support could benefit from a doula. I think they offer quite a lot of education prenatally. They have a huge background in advocacy, And they're also a really great aspect for physical support in labor. They're going to do the back massages. They're going to grab you water when, before you say that you're thirsty. They're going to grab the fan when they notice you're getting a little sweaty. I personally have experience as a doula. I was a doula for 4 years inside and outside of the hospital. And I think that all midwives have some degree of a doula within them because we love and support our birthing people, and we want to make sure that they're feeling heard and they're well educated for their birth experience. But midwives can't always serve as a doula. So it's very important that you know the difference between having your midwife there that's going to support you, but also needs to monitor you and your baby and make sure that you're safe. And then also having a doula on the side that can help you get through your labor experience.
Good points.
Yeah.
Yeah, for my birth, I had one doula with my first, and I had 2 doulas with my second. So that's how much I believe in doulas. We love doulas. They're really great. If you need recommendations, we have some. So yeah, we're fully behind the doulas. There's no limit to how many people you can have at your labor and birth. That's going to be up to you. The siblings can be present. There's really no age restriction. The one recommendation that we do give is that you have an adult there that can take care of the children. If need be, if they don't want to be present in the birth room, that it is not, you're not going to be hurt if they're not in the birth room. So like, say you have a 2-year-old who's having a tantrum, that you have someone that could deal with that, that's not going to be your partner who you might be sad with if they miss the birth. So that might be one rule of doula.
Yeah, that definitely be a role.
The other good thing to remember about birth is that it's best if you feel like you have privacy and that you're not watched. So you'll see sayings on the internet that say, for every person at your birth, add an hour of labor time. And I think that's especially true with first timers. You can feel like so much pressure and you don't have as much faith in yourself as you do subsequent times. So you want people that are at your birth to each have a role and to be fully supportive of you and of home birth. Because if they're not and you're taking a while, why haven't you had the baby yet? Is something wrong? Like the anxiety and the nervousness can be contagious.
Yeah.
So that's one good guidance I would give. Okay, how do you feel about elective induction, which means when there's no health problems? I would say it's usually not a good idea. It can lengthen labor or it could not work. So that's something we don't really recommend or encourage. If there's nothing health-wise going on, it's best to wait for labor to come. There's rare exceptions that I have supported people in this. Maybe they have 5 kids and their partner's going away in the military and they really need to have this baby with him here. Something like that, where there's not really a health or medical indication. I have supported people, but in general, I'd say that's not a good idea.
Yeah, I agree. And to double back to when we talk about client-led care, sometimes people really do want this and we're here to support that. But this is one of those times where we would put in our 2 cents on, let's not rush a good thing and just wait for baby to come. So it's easier for you in the long run.
Yeah, and it does require those patience, those last couple of weeks of pregnancy.
Mm-hmm.
Okay. So how do we monitor the well-being of baby? We are doing intermittent auscultation according to national guidelines with a Doppler. So that means we're placing a Doppler on your abdomen and we're listening to the baby during contractions, after contractions, always with your permission. It's waterproof, so even if you're in the water, we can listen. And we come to you. So it's different than in the hospital where they put a big belt around the belly, which could be quite tight. This is intermittent guidelines. So usually in active labor, it's about every 30 minutes, but when you're pushing, it's maybe around every 5. And so we're monitoring the baby's heart rates within normal range. We're also monitoring your vital signs to make sure that your blood pressure is normal, your heart rate's normal, and your temperature's normal. So we're making sure that everyone is tolerating labor well throughout the process.
Yes.
Okay. What are our policies about being active and moving about in labor? We love it. It's kind of mandatory. We will get you up and changing positions and doing gymnastics, because when you move, it helps the baby figure out how to move and come through.
Yes.
Yeah, eating and drinking labor, you need it, especially because most of our clients do not have an IV. And so in labor, you're going to be needing to drink water and electrolytes and also have calories. So that could be smoothies, could be really whatever you want. The best food for labor is usually things that are quick to eat and easily digestive. We have no restrictions on that and are actually pushing fluids and food on you all the time.
We recommend the high calorie things too. I hate the zero sugar, zero calorie electrolyte drinks. Throw them out for labor. We want full calorie, full sugar, everything you can to get nutrients to you and your baby.
Yeah, and you're running a marathon. So they've done studies that labor goes better when you're getting about 250 cc's or milliliters of fluids an hour. So that's about 3 8-ounce glasses. That's a lot, you know. Typically in the hospital, they don't give you that much. They give you like 125. So you need a lot of fluids to get through this process. Positions for birth, we love them all. I would say our most popular positions, what do you think, Jordan, would be hands and knees or kneeling in the tub?
Yes, we do see occasional squatting too. I think is helpful. And depending on where you're at in labor, you know, we might recommend certain things based off of spinning babies to help you with position for baby to make it easier for you. They're not always fun, but they are helpful.
Yeah. So that's a good question. What's your approach if labor is progressing slowly? So it really depends on what's going on. If it's early labor, that means you're not quite to the active phase, you're not 5 or 6 centimeters yet. We would encourage you to sleep. Maybe go to the chiropractor, do some position changes, right? If it's active labor and you're already 5 or 6 centimeters, you might still need a nap. If contractions have slowed down, take a nap. If contractions are going strong, we're going to recommend some of those spinning babies, some of those position changes. If we feel like we need to increase or augment contractions, we might do some breast pumping or clary sage, some herbs like cotton root. So we know a lot of different things that can help speed along if they're necessary. But sometimes what you need is a rest and a nap.
Yes.
Yeah.
People are pretty exhausted, and that can cause labor to slow down. And another part is being there a little bit too early in your space. You're feeling watched, and it might be time to get some space from everybody and really focus inward. So just depends on what's causing it.
Yeah.
Yeah.
What percentage of time do we find it necessary to cut an episiotomy? That's where you cut through the muscles of the perineum and vagina. I would say very little or nope. That is not a good thing to do most of the time. I have only done 3 of those in my 21 years, which works out to less than 1%. It's actually less than 0.1% of the births. So most of the time, it is better for you to tear naturally than for anyone to cut into your vagina.
Yes.
Yeah, cutting into the vagina automatically goes through the tissue, makes you more prone to have 3rd and 4th degree tears, and can cause pelvic pain and issues for years in the future. So it is only done in rare, very rare emergencies. And I think a lot of people really overuse that in the hospital. I got a lot of clients because there was a local doctor who would cut episiotomies on everybody. So I got one woman who was having baby 5, and he'd cut 4 episiotomies on her already. And she came to me babies 5 and 6 and did not need any episiotomies.
You just don't need them.
You just don't need them. Okay. So coping with labor pain.
How do you recommend that I prepare for managing pain during labor and birth? Step 1 is prenatal preparation. Okay. We want to prepare you for what to expect in labor, and then also ways to manage labor very early on and through every stage, right? So classes like hypnobirthing, hypnobabies, meeting with a doula, releasing any fears and anxieties around birth, and just learning as much as you can about the process is going to help you in the long run. When it comes to coping with labor pains, there are some drug-free options, and then there are also some, options like nitrous as far as being at home that you can use to cope with labor pain. When it comes to thinking of ways to cope with pain in labor, I think it's important to remember that no matter what, even the best drugs in the world, the best epidurals in the world, will not take away every single sensation. So releasing the expectation that, oh, the TENS unit's going to take away all of the back pain will help you as well. We just want something to take the edge off so that you can focus on your breathing techniques more, right? So things like TENS units, sterile water injections, which are little blebs of water under the skin to decrease back pain, rebozo, massage, getting in and out of the tub for labor. So submerging yourself in water or getting in like a nice hot shower would be helpful. Heating pads, homeopathy, and then things like positions in labor. To go back to what I was saying before, releasing your expectation around taking away all the pain, keep in mind that sometimes discomforts and pain in labor actually help your labor progress. It'll help you get into different positions because certain ones are going to be uncomfortable depending on what stage you're in, and can actually help labor progress faster. So the only way out is through.
Mm-hmm.
When it comes to the epidural talk, this is a question on what if I decide I want an epidural. We don't do epidurals at home, so anybody who decides that will need to go into the hospital to get one. We always will have a plan B for you if you decide to change your mind about home birth and you want to go to the hospital. This is not something that hospitals do. If you walk in there and you decide you want to change your mind and have a home birth, they don't have a plan B for you for that, right? But we have a plan B for the hospital. So in the cases of I want an epidural or I've changed my mind about a home birth, we're always going to call the hospital ahead. We'll give you your records, give report to the charge nurse, and then we come with you. In a non-emergent case like pain management, we won't be calling 911 and getting an ambulance involved. That might be a little traumatic, because it's just not an emergency. We don't need to do that. So we'll go over in our cars to the hospital of your choosing. Sometimes we'll call around first and see if there's anybody on, a hospitalist or a midwife on call that we've worked with before that we enjoy to make the process a little bit smoother for you. And then we kind of serve as a doula during your birth whenever it comes to being at the hospital.
Beautiful. So I've realized we've reached our time limit on this video, so we're going to take a pause, but look forward to part 2.